Infertility in a man can be as a result of problems with sperm formation, problems with transportation of the sperm, or the concentration of the sperm. So if a man has problem in any of these three categories, unfortunately, he will have fertility problems. Hello everybody and welcome to Irene Talks. My name is Dr. Irene and today we're going to be looking at male infertility. And you are welcome. If you're watching me for the first time, you are welcome. If you're a returning viewer, you are also welcome. If you've been watching me but you haven't subscribed yet, come on. What are you waiting for? Subscribe! Remember to subscribe, remember to like, remember to share. Follow us on social media. We're on Facebook, we're on Instagram. You can follow us on any of these platforms and you can get updated on whenever we post our new videos and things like that. Now, today is going to be episode 2 of our infertility series. And remember the last week we talked about causes of infertility in women. We talked about things that can cause a woman not to have ovulation. We just talked about some things. And we talked about things that are necessary for somebody to get pregnant. And if you remember, we talked about something called male factor.
So the first is healthy sperm and the ability for the sperm to be deposited high inside the vagina or in the cervix of the woman. This is a male criteria.
So male infertility can be broken down into 3 areas, and today we'll be focusing on just one of the areas. So these 3 areas are areas that can be affected in a man to cause a man not to be able to have children, right? So we can have areas that are pre-testicular. Pre-testicular refers to those areas that are contributing to sperm production, contributing to hormone production and things like that, but they are not found in the testes. Then we have testicular area. The testicular factors and testicular things are things that are found basically that can happen to the testes that will cause a man to not have children. And then we have post-testicular. This is after the testes. I mean, you have things that can happen while the sperm is being transported, or like for example ejaculation issues and things like that. These are post-testicular problems. So we have pre-testicular, testicular and post-testicular. But today we are going to be focusing on testicular problems. We are looking at things that can happen to the testes that can affect the man from being fertile. The reason why we are focusing on the testes today is because the testes is the area in a man's body where sperm is produced. Also, these testicular factors are very important to know because many of them are not reversible. So it's important for you to know them now to see how you can prevent them from happening or occurring. So stay tuned. So firstly, we have genetic causes. There are so many genetic conditions that can cause infertility in men, but today I'll be talking about just one. This one is actually one of the most common. It is Klinefelter syndrome. And in this condition, the man has 47XXY instead of 46XY. So he has another X chromosome. And you can see it actually physically in men that have this condition. They tend to have man boobs, as we like to call it. We don't call it like that in medicine. In medicine, it is called gynecomastia. But many of us will refer to it as male boobs. The man also has problem with fertility. In his semen, he actually might not have sperm in his semen, and this condition is called azoospermia. The man, while growing up, he might actually have delayed puberty, or very delayed sexual maturation. So it takes a while for him to get all that facial hair or anything like that. For many men, they might not actually recognize that they have this genetic condition until when they are trying to have a child. So it's very important to keep your eye out, watch your sons, watch yourself, look at yourself and cross-check yourself for important things like this. So next we have toxins. Some things are actually toxic to the male testes, and those things include radiation and drugs. When I say radiation, I'm talking about high intensity radiation frequently. For example, in cancer patients that are treated with radiation, or if you work in a place whereby you are exposed to high intensity radiation. So if you work somewhere where you are exposed to high intensity radiation, it's important that you wear the proper gear. As I said, drugs. Some drugs can actually cause infertility. And when I say drugs, I don't just mean illegal drugs. Yes, illegal drugs are part of them, but I also mean medications that treat conditions. Some medication for hypertension, for example, or some medication for depression or things like that can actually cause infertility. So if you're constantly taking any medication and you are trying to have a child, it's important that you talk to the doctor about the kind of medication that you're taking, so that if necessary they can supplement it with something else. Also, recreational drugs and alcohol have been linked to infertility in males. Next, we have some chronic diseases like kidney failure, liver cirrhosis that is mostly caused by excessive alcohol drinking. We also have sickle cell disease, and we have diabetes. These conditions can also cause infertility in males. Next, we have injury to the testes. A very common cause of injury to the testes is orchitis. Orchitis is when the testis is swollen due to infection. It can be bacterial infection, it can be virus infection. But a very common infection that causes orchitis is mumps. Mumps is a virus that causes the salivary glands to be swollen. It can end up causing orchitis and then eventually infertility. You can prevent mumps in your child by having your child vaccinated. There is a vaccine called the MMR vaccine, that is the mumps, the measles and the rubella, and this vaccine would prevent your child from getting mumps. Another cause of injury to the testes is torsion. Torsion is when there is a twisting. This twisting causes a lack of blood flow to the testes, and if it is not discovered fast enough and surgery done soon enough, it can cause infertility in the man. The final cause of injury to the testes is trauma. That is when you have direct hit to the testes. It can happen in accidents, or for people that are athletic, it can happen to them as well. This can also lead to infertility. Next, we have cryptorchidism. That is when the testis is not in the scrotum. It can be anywhere else, or it can actually be missing. The final cause I'll be mentioning today is called varicocele. Varicocele is when you have dilated veins, swollen veins that are no longer functioning as they ought to. So how can you prevent this? How can you prevent these causes from actually happening to you? As I said, unfortunately, majority of them are irreversible, but you can prevent them if you detect them early. For example, with torsion, which is one cause of testicular injury, if you detect the pain early, you can go to the doctor and it can actually be resolved. But that only happens if you detect it early. With Klinefelter, for example, if you notice that you have those conditions early enough in life, it is possible that you can be put on the necessary hormonal therapy. They give you hormones that are necessary to help you go through it. So some of these conditions, what you actually need to do is to detect them early. When you see pain, when you feel pain, or you feel something out of the ordinary with you, it's important to go to the doctor. It is also important to have lifestyle changes. Involve yourself with more physical activity to prevent some of these systemic diseases like hypertension, like kidney failure, like liver problem. Reduce the amount of alcohol intake that you have. Some of these lifestyle changes will not just help your fertility, it will also help your overall body. I hope you enjoyed this video. I hope it was very educational to you. Please guys, it is very important that we pay attention to some of these things that I've mentioned here, just to prevent us from heartache in the future. Remember to like, subscribe, and share these videos, and watch out for upcoming episodes in the future on infertility. I'm not done yet with talking about male infertility, and I'm not done yet with talking about female infertility. As I said, there are a lot of things to know. So stay tuned.